This is The Rounds Table. All right, welcome back to the channel. Solo episode today. I'm going to be covering the recently published Tirzepatide versus Semaglutide for the treatment of obesity, published in an up-and-coming journal called the New England Journal of Medicine. All right, quick backdrop here. I think we all know this, but it bears repeating. Obesity is very common. It affects 1/3 of people living in North America. And unless you're living under a rock, you've probably heard of Ozempic. It goes by the generic name Semaglutide. The relatively new kid in town is Tirzepatide. It acts similarly to semaglutide, but it also has GIP properties as well as being a GLP-1 receptor analog. So that GIP aspect is a differentiator compared to semaglutide. There's been a bunch of randomized trials showing it is incredibly effective for weight loss, but there have been no head-to-head trials. There's been no large-scale randomized trial of which is better, Tirzepatide versus semaglutide. So enter the SURMOUNT-5 trial, and their objective was, that's right, to compare these two medications. So this was an industry-funded trial. In particular, it was funded by Eli Lilly, and I think we know why they funded this trial. It was open label. It occurred across multiple sites in the US. The population, adults with a BMI of 30 and up or 27, and an obesity-related complication such as hypertension, sleep apnea, dyslipidemia, or cardiovascular disease. A few key exclusion criteria: if patients had type 2 diabetes, if they had an upcoming surgery plan for their obesity, if they had prior treatment with a GLP-1 analog in the past 90 days, or if their body weight wasn't stable. Said differently, if they had lost 5 kilograms in the past 90 days, they were also not included. The intervention was Tirzepatide. As a reminder, that's a once weekly injection, and dosing was max tolerated, which typically meant 10 to 15 milligrams once a week. Comparator semaglutide once a week up to the max tolerated dose, which was typically 1.7 to 2.4 milligrams. The primary outcome was a percentage of body weight loss by week 72. All patients also received counseling on nutrition and physical activity, and this trial was powered to show that Tirzepatide was superior to semaglutide, which shouldn't surprise anyone because the manufacturers of Tirzepatide funded this trial. The sample size needed was approximately 700 patients. So what did they find? Well, they screened 950 patients and 750 were randomized. 85% of patients completed the trial, and this was similar in the two arms. The mean age was 45 years, 65% were women, 76% were white, and the mean BMI was 40. Overall, treatment was stopped due to an adverse event in 6% with Tirzepatide and 8% with semaglutide. And, drum roll please, primary outcome, what did they find? With Tirzepatide, they observed a 20% reduction in body weight, as opposed to semaglutide, which is a 14% reduction in body weight. So clearly, Tirzepatide was superior for weight loss. Some important secondary outcomes. So they observed a reduction in systolic blood pressure with Tirzepatide of approximately 10 millimeters of mercury compared to semaglutide, where the systolic improved by 8 millimeters of mercury. In terms of safety outcomes, the most common were GI. This includes, diarrhea, constipation, which affects almost a quarter of patients on either drug, nausea, which affects almost 40%. Injection site reactions were far more common with Tirzepatide at 9% compared to semaglutide at 0.3%. So what were some limitations of this trial? As mentioned, this was, funded, planned, written, analyzed by Eli Lilly, who are the makers of Tirzepatide. Another important limitation, it was an unblinded trial. And it would have been great to know, okay, how about the costs? That was not, of course, an endpoint that they looked at or really discussed in much detail. So how do I contextualize these results? It's very rare to see large head-to-head studies of any medications. And I gotta applaud the authors for this, even though they knew exactly what they're doing And they knew going into this that they were probably going to show tirzepatide was superior. But still, think of any other diabetes drug, for example. Like, there are no large-scale randomized trial of empagliflozin versus semaglutide. No, those trials are almost always placebo-controlled. So I appreciate that we actually have some comparative effectiveness data here and done so with a randomized trial. Personally, I mainly prescribe semaglutide. That's a reflection of its cost where I work. So in Canada, the cash price for it for people who don't have a drug plan is $200 a month. And for adults over 65 who have diabetes, it is covered. So there's no out-of-pocket expenses. With tirzepatide, it's been available in Canada for the past couple of years now, but patients have to pay out of pocket if they're over 65 because it isn't covered. And the cost is, almost double. So $450 some odd per month. In the US, the price of both of these is, many orders of magnitude higher. And again, tirzepatide is much more expensive. A few other discussion points. It was interesting to see that the adverse event profile was relatively similar for these two drugs, except for injection site reactions, which was far more common with tirzepatide. So that will be good to know when we're counseling our patients. I do want to spend maybe a minute discussing the reduction in systolic blood pressure. This is something that I've certainly seen in patients where I've prescribed them semaglutide. They have hypertension, they're on multiple blood pressure medications, and now their blood pressure is like the best it's ever been. So I wonder about the role of this medication, either medication, in the setting of a patient who they have obesity or diabetes, and they have really hard to control high blood pressure. This feels like a very good drug to be using in that scenario. All right. Yeah, I think that's all I had to say about this trial. Overall, impressive to see these results. And it sure is fun to be a general internal medicine doctor. We have these highly, highly effective medications for patients who have obesity or type 2 diabetes. I think that's it. A final plug for Trial Files, which I'm sure many of you have heard me discuss before. It's a once every couple of weeks newsletter via Substack, which summarizes practice-changing trials. And a link to that will be in the show notes below. Would love to hear feedback. What did we get wrong? What should we do differently? And yeah, that's it. Take care.
The Rounds Table is hosted online at medicinepods.com, your one-stop source for comprehensive internal medicine education and evidence-based medicine resources. We can also be found on all of your favorite streaming services. You can also follow us on Instagram, LinkedIn, and X. And special thanks to our audio editor, Tamara Van Bakel.